Aloha, my name is Josh Green. I'm your host today on a new program, Healthcare in Hawaii. This program is meant to explore the entirety of our healthcare system in the state. As many of you know, we all rely on healthcare for our families, for our friends, for ourselves throughout our lives. It's the one issue that really touches every single life in the state, and it's why it's so important to me. Just to give you a little bit of an overview of where I'm coming from and what I'm about, like I said, my name is Josh Green. I have a couple different hats that I wear. I'm an emergency room physician, have been for 13 or 14 years since I came to the state of Hawaii. I came here with the National Health Service Corps, where I served on the Big Island of Hawaii in Ka'u, working in a community health center. After a few years, I was interested in health policy, so I ran for public office and was elected to the House of Representatives, mostly to focus on issues like drug addiction, concerns about healthcare access in our community health centers surviving, and really just how we could make a better healthcare system for our people. After a few years in the State House of Representatives, I was elected to the State Senate and now serve as the health chairman in that body. So I continue to work on these healthcare issues. In addition to that, I'm a medical director for a very large physician group in the state of independent physicians. So these three perspectives kind of have me constantly thinking about what can we do for healthcare in Hawaii. That's the topic of our show. Over the next several months to maybe years, we'll be talking with experts across the state, and we're going to get their perspective on what matters to them, how they think they can improve the healthcare system, how we might be able to help them, what are the big challenges in healthcare that we all face. And that's really what I want this show to be about. We hope that you will contact us with your ideas for new programs on healthcare. We hope that you will send your questions in when you see our show. We really want to reach out to the people and make this an interactive program. Today I have the distinct pleasure of having a very highly esteemed guest. Her name is Beth Giesting. Beth's going to tell us a lot about herself here in a moment, but I do want to give just a brief overview of what perspective she brings. Beth, for several years, ran the Hawaii Primary Care Association, where she was an advocate for healthcare access for all the people in our state. In that capacity, she had an incredible perspective of the biggest problems that people often face, especially if they're economically challenged in trying to get health care. Beth drew a lot of people's attention for her excellent work in that capacity, and then was nominated by the Governor Abercrombie, to serve as his Healthcare Transformation Coordinator, a job she began just about 2 years ago on September 1st, 2011. And we're going to let Beth explain what her job is all about, but the reason I've asked her to be my first guest on this program is because Beth has an enormous perspective of the healthcare system, a lot of its challenges. She knows a lot of the people that have been working in healthcare as healthcare leaders, but she's also seen it from the inside out, and so she knows what matters most to people. That's why I wanted Beth here today with us. So Beth, why don't we call that our first introduction and tell us a little bit about yourself.
Well, thank you, Josh. It's really a pleasure to be here. And yes, my background is really very primary care and community health center focused. 30 years ago, I started as the executive director of Kalihi Palama Health Center here in Honolulu. And the issues there were poverty, people who were fairly recently immigrants, had language and cultural issues. We were an increasingly comprehensive health center taking care of people from all over this county. And so from there I went on to head up the Hawaii Primary Care Association, which is the association of all the community health centers. So I have a very thorough grounding in that part of healthcare and access and primary care and workforce and all of the issues around that. When I went over to the governor's office to be the healthcare transformation, it was truly a learning experience because healthcare is such an enormously broad topic. Here in Hawaii, we spend more than $9 billion on healthcare every year, and it's about hospitals and specialists and health information technology. And fundamentally, it still comes down to access and good primary care and following through.
So that's really why I think that the governor saw fit to hire you, Beth, was to bring that perspective that you have on kind of the multitude of the challenges in the healthcare system. I think just to frame it for our people that are viewing, why don't you tell them a little bit about the landscape of healthcare in Hawaii, what some of the challenges are, you've spoken and done work on the uninsured. Why don't you give people that foundation so then we can kind of roll into what the health transformation job really is?
Sure. Well, because we're an island state, that truly is a unique challenge for us, where the distribution of health resources is quite uneven. So we here in Honolulu frequently don't even think about how hard it might be to get access to health care in rural areas across the state. We have excellent hospitals, we have the core of the medical school here. There is just so much going on in Honolulu. And there is clearly a lot going on neighbor islands where the population is growing and the needs are growing. But there's also much greater struggles to make sure that people have access to primary care, to specialty services, that they have good access to emergency rooms and good hospitalization. So those are some of the issues that we're dealing with. Workforce, health information technology, all of those things are changing dramatically with the changes in our healthcare system. And trying to plan for and manage and bring everything together is really what healthcare transformation is all about.
Yeah, I've often kind of ruminated on some of those problems, and I guess from the perspective, well, one thing I've often said was we in some ways have two healthcare systems in the state of Hawaii. We have the Oahu healthcare system where, for the most part, you can find certain subset of specialties and doctors, and we have challenges. There's no question we have shortages across the board, but there are many hospitals to access, and at all days, day and night, you're going to be able to find a provider. Whereas if you're on the Big Island, where I practice, or on any of the neighbor islands for that matter, you have a very serious shortage of providers. I could tell you a vignette from last weekend. I was taking care of a very sweet young man who was thinking about hurting himself, and we needed to provide some mental health support for him. But in order to get him care, there was no child psychiatrist or adolescent psychiatrist that was available on the Big Island, and it necessitated permission from his family to be transferred to Oahu. At the time when I called, none of the facilities had any space. Ultimately, he got care on Maui, but it was very difficult to get this kid care, and he really needed it. And his counselors did a great job bringing to our attention what his needs were. But had he been on Oahu, there were many more options that particular day to get care. Another guy came to me with a big heart attack at 5 in the morning in the ER, and we had no ability to get him a cardiac catheterization for that heart attack. Fortunately, I have a very good relationship with Dr. Kogan, who's one of our best cardiologists in the state, and I was able to electronically transmit copies of his electrocardiograms for his chest. He quickly saw the problem, we arranged the flight, and within 90 minutes he was getting that invasive treatment to save his heart. And it worked out very well, thank goodness, because that specialist was able to help. But it was a very different experience than people would have had on Oahu.
Yes.
What other challenges do you see? For instance, people's insurance. We know that that's been a big question in the federal government, the Affordable Care Act, which I'm sure we'll touch on.
Yes.
What's Hawaii like as far as how many people are insured? Who are these people? Who has challenges finding insurance?
Well, that is one of the issues that Hawaii has actually been relatively at the head of the line. We've done well in making sure that most people have insurance coverage, so that we have Medicare for the elderly and disabled. We have the Prepaid Healthcare Act that means most people who have jobs also have really good health insurance. We have a relatively generous eligibility criteria for our Medicaid program. And so we have had a pretty small number of people who are left uninsured. We're somewhere in the top 5 in the country already. And we have about 100,000 people who have no insurance. However, talking about insurance coverage sort of minimizes the problem, because you might have excellent coverage, and if you can't get in to see a doctor in some of the areas on the Big Island and in other places, it remains very problematic. But we have a significant number of people who have Medicaid coverage,
Right.
and because of the way Medicaid is paid for, it's not necessarily a popular form of insurance. And so we do have some low-income people who have coverage, very little access to care. People who are uninsured, which is a shrinking group and going to be shrinking under the Affordable Care Act because of some of the changes there. They really have problems getting health care outside of emergency rooms and, of course, community health centers. And so, fortunately, we do expect that very soon, in fact, by January 1st, we will have some solutions to get almost everybody in the state covered.
Okay, so let's bring people up to speed then. So what you basically said is about 100,000 people are uninsured in the state of Hawaii, and that will be a dwindling number for reasons that we've all read about, the Affordable Care Act and our commitment to insuring people. And then we have, it's my understanding, about 295,000 people that are on Medicaid in the state, which is a very substantial number of our citizens. But what we're saying is, even if we get all these individuals insured or we have the Medicaid insurance, they just might still not have a doctor or a nurse practitioner or a physician assistant to take care of them. Which brings us, I guess, to the question initially of healthcare transformation. Is that why we're asking you to help transform our system?
Well, that's part of it. Really, the biggest reason for healthcare transformation, though, I think, is because our healthcare system has become so complicated. We have the opportunity to be truly excellent. We have lots of technology, we have lots of well-trained specialists, but our system somehow has gone awry so that there is not the core primary care and care coordination that's holding everything together. And so we have an incredibly fragmented and complicated system that patients have a hard time navigating, that wastes a lot of resources. It's one of the reasons that the American healthcare system is by far the most expensive in the world, and it doesn't even cover everybody. Because we don't rely on primary care, because we're not coordinating services, because we're just not taking advantage of all of the things that we could do better. And so healthcare transformation is to try to bring our system, our so-called system, into a real system so that it's coordinated and so that people actually get what they need and it's easy to use. And whether they're uninsured or not, they should be able to get access to that. Now, the Affordable Care Act is pushing the coverage, universal coverage of everybody, because only when you get everybody in the system can you truly make your system act like it is moving in the same direction, that everybody's priorities are the same, which have to be good patient-centered care.
It's interesting that you mentioned that, because when I was trained as a family practitioner, which is what I did my formal training in, that's what we focused on. Family practice at the time was essentially this coordinated healthcare approach. In other words, you had a family doctor, so the family doctor knew, yes, this person suffers also from depression and they need support from a psychologist, or they have problems at home and economics are a question, so we have to make sure that their medicines are affordable, or they hear, because they're the family doctor in the community, they hear from the school teacher, not just the parents, and they quickly realize maybe this child has attention deficit disorder or dyslexia or some other learning disability, which then contributed to frustrations or challenges or goodness knows what. So we had a coordinated system, I think, when healthcare was maybe simpler and more straightforward, but now the technology is such a gigantic part of it, and the multitude of health insurers, which 40 or 50 years ago there weren't health insurers, period. All of these layers, I think, have made things more complex, not less, and maybe we've lost our ability to provide quality, coordinated care or simplified care to people because of that.
Right. So in our plan to transform healthcare, we are looking at the big picture, trying to change the system to make it more patient-centered and better for everybody. And then part of it is also working more directly with our so-called underserved communities, those people where there are great health disparities. So for the main part of the population, what we are trying to do is promote what we're calling patient-centered medical homes, which is probably not the best term. It doesn't indicate that it's home health or institutional care, but rather the home base for people to get their health care. So it indicates that you have a long-standing relationship with your primary care doctor who will help identify and treat problems early, that it really is focused on what is best for the patient and their family and brings them into the decision making by providing information and transparency all across the healthcare system. A patient-centered medical home also uses a whole team of providers so that you may have more of a working relationship with the social worker in your doctor's office than the doctor, him or herself.
Beth, let's pause here. This is very interesting to me. I think we're going to take our break after 15 minutes and then come back, and I think where we'll pick it up is right with the patient-centered medical home.
Okay.
Great.
Aloha, this is Jay Fidel. You know, ThinkTech and the Hawaii Venture Capital Association put on monthly lunch and panel programs at the Plaza Club here in Pioneer Plaza. Our program this time is on September 26th. It's called Solar in Hawaii. We're going to examine the solar industry and see what's in it for the long haul. We have a great panel, great moderator. We'll be sending out email on this. If you want to be in our email list to receive the details, check out thinktechhawaii.com. In any event, you can sign up for the program at hvca.org. Thanks. See you there. This is Jay Fidel. Mahalo.
We want to thank our underwriters.
Hawaiian Electric Company and its affiliates Maui Electric on Maui and Hawaii Electric Light Company on Hawaii Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company.
The High Tech Development Corporation, the state's leading technology agency, attached to the Department of Business, Economic Development, and Tourism.
Castle and Cook Hawaii, with a time-honored legacy that spans more than 160 years and revolves around its mission of investing in Hawaii, creating communities, and providing for the needs of our state.
Hawaii Gas, formerly the Gas Company, a proponent of the Liquefied Natural Gas Initiative, helping Hawaii achieve its transition to clean energy and a better energy future.
Collateral Analytics, a Hawaii-based tech company empowering the real estate industry with greater and faster access to the tools and data they need to make better informed property investment decisions.
I'm Nicole Horry. Thanks so much for joining us on ThinkTech.
I'm Maria Kashem. See you next time.
Welcome back. My name is Josh Green, your host at Healthcare in Hawaii. Today we have the distinct pleasure, as you know, of having an expert in Beth Giesting, who is our Healthcare Transformation Coordinator at the Governor's Office. In our first 15 minutes, we were able to discuss and establish that there is a healthcare challenge in our state, that the system can be sometimes uneven. Sometimes it's difficult to access healthcare. If you have Medicaid, which is the Quest program, or if you're uninsured, it's very difficult to find a physician or a nurse practitioner to take care of you. And we began to explore what some of the solutions might be. Beth has begun to tell us a little bit about a new concept, at least a new concept as it's being implemented here in our state, called the patient-centered medical home. So that's kind of where I wanted to pick it up again, Beth. So tell us more about the patient-centered medical home. Tell us how it's going to help transform the healthcare system and really why that's a focus of yours.
Sure. Well, the patient-centered medical home is, as it implies, patient-centered, and that's probably the most important thing. Our healthcare system has become so complicated and so far removed from what the patient's understanding and sometimes their desires are, that we really need to pull it back and focus on what's best for the patient and the outcomes that they need for better health. So a patient-centered medical home is a long-term relationship between the patient and provider, and the provider is a team of people. It's probably a physician at the head with possibly nurse practitioners, physician assistants, psychologists, social workers, community health workers, RNs, a whole host of people who can help improve the care of the individual and take a much broader view of what they need and what is going to meet their convenience. The other thing that's really important about the patient-centered medical home is it coordinates care all across the system. So I have a long-standing relationship with my care provider, my primary care provider, but when I need a specialist, my provider sends me to the specialist with all of the pertinent information about my care and why I'm being sent there. The specialist doesn't have to duplicate all the tests and ask me the same dumb questions. And after the treatment is done, my records go back to my patient-centered medical home. And whereas that seems really simple and straightforward and one of those duh kind of moments, it doesn't happen in our healthcare system right now. And that really is a crucial building block for how our health system needs to be developed going forward.
I would again hearken to the old days when it was just a family doctor running your care, and whether or not it was called a patient-centered medical home, they knew you. They knew you well in your small town. They knew what you needed. They knew what medicines you were on, and they probably knew what your medicines and health problems that your parents suffered from. So in the old way, it was in some ways more coordinated, whereas now the system's become, like you use the word, fragmented, where there are specialists all over the place on different islands, maybe even on the mainland, that people utilize. There are fancy tests that have to be incorporated into a person's healthcare plan. So I think that what you're suggesting is that this home, this patient-centered medical home, is the place where all of that data and communication will live, so that not only do we get good care for people, good quality care, but we don't order the same CAT scan twice, which costs $1,000. We don't send someone over for a consultation, which could be expensive, from a very highly qualified specialist, and then not get feedback to actually incorporate those tests or new insights into actually how to care for the patient.
Right. And one of the other important things to note is that as people are living longer and as health status changes, we have a lot more people with chronic diseases and people who have more than one chronic disease. And so that really creates potentially a lot of complexity and fragmentation in their healthcare system. So if you have all the records all in one place, even if I go to a specialist about my diabetes, somebody also knows about my heart condition or my asthma or whatever, and can put all the pieces together so that I'm not taking the wrong medication because it conflicts with something that my other specialist provided me. So that is also one of the reasons why we have to be even more purposeful about coordinating care.
Well, let me ask you this. So I could see the logic to that. I agree with it. Something I promoted, when I work in the private sector, for sure, with the IPA. But tell me how the Healthcare Transformation Office is addressing it. What's your approach? Are you making recommendations to insurers to pay for a patient-centered medical home model? Are you convening physicians, or is that the approach? Because it makes so much sense. How are you guys approaching it? And then are you able to recoup savings and then reinvest them? I mean, what's the approach?
Well, fortunately, we are not the first people who are talking about patient-centered medical homes. There has been discussion about that in some circles for decades, but most recently here in Hawaii for, the last 4 or 5 years. And some of the insurers have been very progressive in leading the way and trying to get people on board with this. The healthcare organizations, the IPAs and others, are also trying to help their members move in that direction. So I would say that our role here is to bring all of the stakeholders together to identify the best model and really try to coordinate them so that we have only one model. For instance, if a physician has 3 or 4 different insurers that they're working for, and they're all looking at a different definition of patient-centered medical home, and they all want to reimburse on a different basis, it will certainly drive the provider crazy. And so we're trying to get all of the insurers to say, yes, this is our single standard definition. These are our core quality measures. This is how we're going to be paying for patient-centered medical home and quality incentives.
So you're saying admin simplification then?
Admin simplification, getting everybody on the same page, moving the agenda forward in that way.
Do you meet resistance? I mean, how does it play out with people?
Well, it remains to be seen how much resistance there will be, but so far there has been a lot of enthusiasm, because I think one of the important reasons why healthcare transformation has to be in the government is because the private sector truly cannot coordinate all of the things that need to happen to transform healthcare. They have their own agendas. They only control part of the market. They're not allowed really to meet together to come up with decisions that everybody has to abide by.
They have antitrust. They have antitrust concerns.
Antitrust. So at this point, I would say there is a lot of support for moving forward with these things.
I appreciate that, and next week we're going to have Hilton Rathel, who's the Senior Vice President at HMSA, probably to address some of these issues that you've brought up, and so it'll be really interesting to get Hilton to reflect on, well, you know, Beth came and told us last week that she would like to see administrative simplification, that the docs are pulling their hair out over some of the complexities when they just want to be practicing healthcare. What are you doing to make that possible? Because I believe HMSA insures some 700,000 or so of our citizens, which is the majority by far of those who need insurance and get coverage. So if they're driving some of these issues, it's kind of nice to have, I guess, a maybe a neutral referee. You might call yourself to deal with HMSA and Aloha Care and HMAA and whoever else might be involved.
Yeah.
Okay, so again, let's double back. We've got a position in the government that the governor has at the top level. You're basically the cabinet level, more or less, yeah?
Yes.
So you're the cabinet level healthcare transformation individual. We also have a Department of Health doing the day-to-day activities of healthcare, immunizations and all these many needs, but they've asked you to take a look at the big picture, right? To make sure the healthcare system, this $9 billion as you described, that's spent, which is a big piece of money spent in Hawaii, and it's small business money and it's tax dollars if it's going to Medicaid or to our community hospitals. So they're asking you to transform the system. Why are they doing that? Do you think it's fundamentally to get more care to people, or better care, or to save money? What's the primary motivation?
Well, I would certainly say all of it. I mean, healthcare is a policy priority for the government just because, as you said in your opening remarks, it affects everybody in the state. We are all stakeholders in the healthcare system, but particularly for the state because, amazingly enough, the state pays for healthcare for nearly 40% of the population right now. So the Medicaid program is a state and federal partnership, but the state really manages that. The Employer Union Trust Fund, the public employee benefit program that covers our public employees and their dependents and the retirees. You know, this is just a tremendous opportunity for the government to change healthcare by making requirements for those people that it contracts for.
Interesting.
And of course, the state is also spending some 25% of the state budget on healthcare. So it's really a big deal for people like you in the legislature when it's time to pass the budget.
It comes up again, and it's even not just about the state government too. And you know, your focus is state dollars, and that's actually, I think, what our viewers are greatly appreciative of, to see that their tax dollars are spent properly. But then if you add the Medicare mandate, which is another large number of people, another 100,000 people in the state, and our military, you know, the people that we respect who have been really saving us and protecting us for many years during this period of war, you know, they come back and they get care through, I believe it's TRICARE as well. So it's something like 57% of all of our individuals in the state of Hawaii have some form of government, either subsidized or sponsored healthcare coverage. And so more than 50% of our people have, you know, some support from taxpayer dollars. So I think that when people say, why is government getting involved, it's almost, well, it's quite clear to me that with that much, I guess, investment in our people, more than half of our people, obviously government is going to need to hold people accountable. The question is, I guess, can it be done better? So when your office takes up healthcare transformation, you mentioned simplification. I think that will come as a kind of a refreshing message to the provider community that you're hoping to simplify things. So tell us again, why is it valuable to simplify? Will that save money?
Well, it will certainly save money and time for the provider. So trying to get rid of some of the unnecessary complexity that each of the different insurers requires in terms of credentialing and their processes, and fortunately everybody does pretty much bill the same way. But that really is going to make it much easier, and just knowing that every single health plan recognizes patient-centered medical homes in the same way, and their methodology for payment and quality measures is aligned, so that I don't have to worry about this. Plan A says that these are the things that I have to be focusing on, and Plan B says I got to do all of these, and then pretty soon you're having to focus on 500 different things, which means that you have no focus.
Right. So I guess before we take our next break, I guess what your message is, you want doctors to be doctors.
Yes.
And that will help all of our people, because they'll actually have their physicians and their nurse practitioners and providers focusing on their diabetes rather than the complexity of billing or the complexity of coordinating care. They'll be able to just go back to the basics and provide care.
Right, and heaven knows doctors have enough things that they have to be worried about now, that it would be nice to not have to worry about their relationship with the insurers as well.
On that note, we'll take a break and we'll be back in a minute.
Aloha, I'm Jay Fidel of ThinkTech. On Wednesday, September 4th, we have an interesting show with Donna Blanchard. She's the host of Arts in Hawaii, 2 to 3 p.m. that day. And her guest is Jeff Geer. He's an international storyteller, and he tells stories about Hawaii. So check it out on ThinkTech, September 4th, 2 to 3 p.m. I'm Jay Fidel. I'll see you there. Mahalo.
Aloha, I'm Nicole Horry for ThinkTech. For nearly half a century, the Hawaii Foreign Trade Zone No. 9 has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBET, the Department of Business, Economic Development, and Tourism, operates Hawaii's Foreign Trade Zone program to encourage international business and economic development. The Foreign Trade Zone's mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Nicole Horry. Mahalo.
Aloha, welcome back again. I'm Josh Green, your host on Healthcare in Hawaii. Today we have Beth Giesting, who's our expert and giving us the perspective of the state government. She's on the cabinet for Governor Abercrombie, and she's been tasked with healthcare transformation. In our first two segments, this previous half hour, we've established that not only does healthcare affect all of us and all of our families, it's also a tremendous piece of our budget. Over 25 cents of every dollar, 25% of the budget spent on healthcare. Over $9 billion in the state of Hawaii. People often have access issues getting a physician or a nurse practitioner to take care of them. They may have challenges with Medicaid insurance that might not offer them the full array of providers that they might like. And so what Beth Giesting has been taking up is how to transform the healthcare system. She explained to us the basics of the patient-centered medical home, how it's a team-based approach to bring a doctor and a team of providers around a single kind of patient-focused healthcare approach so that patient gets better care, maybe even more affordably, but they have access to an array of services. But it leaves us with many questions, and I think we're going to start there. Beth, you've explained to us the patient-centered medical home and the impact that healthcare has on society and on budgets, but what's going to make the patient-centered medical home and this transform model work? What's the engine that's going to drive it to make it actually function?
Well, I think the engine that is going to make it work is the fact that it is patient-centered. It does address our workforce shortage by bringing in a whole bunch of people who contribute to the better health of the patient and coordinate their care. And because it's patient-centered, it also brings the patient into the equation and is going to respond to their convenience and their needs better. One of the things that is so interesting in this day and age with technology everywhere, we have our smartphones and our ATMs and we bank online and all of this stuff. Business has really embraced technology, information technology in a big way, and the healthcare sector has sort of been left behind in the dust. And so one of the most important tools for moving forward transformation is changing our health information technology strategy.
Why don't you tell us what we're doing on that? Because I think that we've heard that at the federal level, the Affordable Care Act, they've put in mandates for people to use EMRs, electronic medical records. I know that there is a group of people, which hopefully we'll have on the program in time, maybe with you, to describe the health information exchange. How is that going to play into your vision for healthcare transformation in Hawaii?
Well, as we were talking about patient-centered medical home, when I get referred to a specialist, my health information is supposed to go with me, and when the specialist does whatever, the information goes back to my medical home.
Yes.
So that implies that my physician is using an electronic health record,
Right.
that record is exchangeable with other providers. So that the health information exchange is truly one of the drivers for making the changes that we need in our healthcare system.
I was going to say it's a significant hill to climb, though, right? Because if I'm not mistaken, the private guys I work with, maybe only 30 or 40% of them have been using an electronic medical record system to its fullest capacity. So how are we going to get them there? How are we going to get the community of physicians and nurses to embrace this?
Well, it certainly is a movement that is gaining momentum. You know, people have been using this stuff for 20 years, but not necessarily very robustly or effectively.
Right.
But under the Affordable Care Act and the funds from and the impetus from the federal government, there are incentive payments in the Medicare program. There are also incentives that were just announced in the Medicaid program to help people use their electronic health records meaningfully. So they're actually exchanging information, they're keeping track of patients. As we move forward through this process, they'll be sharing information with the patients.
Right.
It has just become an expectation for our healthcare systems. Now, actual practice will take a while to meet our expectations, but sooner or later that is the way everything is going. And certainly the people who are coming out of medical school and nursing school and all of the health professions are using electronic health records would not even think about practicing without them.
I was just going to say that the medical students that I sometimes have the privilege of giving a quick lecture to, or the residents that I see, I'm 43 years old and I graduated from residency 13 years ago. We didn't have access routinely to computer notes.
Mm-hmm.
Now they're pretty much graduating with an iPad attached to their hand, and I think that we're going to see that technology continue to just roll out with the trained physicians and nurses. So it's very likely that from the generational changeover in the healthcare system, which is just natural, that we will quickly see 100% adoption in the newbies, so to speak, the new graduates. So maybe that problem won't be as big a challenge. We'll just have to encourage some of my colleagues that have been in their careers longer to adopt it in a kind of a sensible modicum of practice. Maybe not everyone will have a fully robust electronic medical record system, but they will be able to use it in their practice, or they'll bring on partners that will be able to use it. Does that bring us to the kind of one of the central tenets of healthcare reform, which is getting quality care with better outcomes? And we don't really know in many cases whether we're getting good outcomes if we can't look at the data. But with electronic health records, we're going to have a lot more data, and we're going to be able to then say, okay, doctor, you're in IAEA, this is how many patients you have on your panel, but only 70% of them are getting full care for their diabetes or their hypertension because we see it in your records. Why don't we work together? How will that work? How are we going to support those physicians when we recognize that they could improve in one area, or maybe that they're excellent in one area, but another area should be the new focus for them?
Yeah, well, and using health IT effectively is both at the individual provider level and also at the macro level. And so when you're talking about how do we use this potential to improve quality, part of it is just having a system that provides feedback in a timely way to the provider. I mean, we all know that doctors are very competitive, and they're also very smart, and they want to do a really good job for their patients. And so this is a tool that can help them identify where they're maybe not doing as well as they should be. So if they get timely feedback either from their EHR or from the insurer, you know, somewhere there has to be a mechanism to give them the information they need. So that's on the individual level.
Sure.
But the other thing is that we have a health system that in some respects is data rich, because you've got all the claims and you've got clinical information
Sure.
in the EHR, and there's a pharmacy and the labs and all of this stuff, but it's all kind of siloed. We don't effectively bring it all together right now in any kind of database to make sense of it. So we don't know quite where the costs are because we can't pinpoint it. We have no data. We don't know quite what's working and why. And so one of our thrusts is also to build a database to pull it all together so that we can examine and use the information effectively to continually improve the evidence basis of care, to make sure that we are clearly living up to quality standards, that our costs are not more than they need to be. That really is one of the key issues about health information technology too.
Yeah, well, I think so. Basically what you're saying is that in order to invest in the right places in healthcare, we need to get the data, and only by getting a better data system, you used the term EHR, electronic health records, only by really seeing that we should be devoting more time and attention to diabetes, because that's where we'll decrease suffering, where we need to get more access for a certain part of our population. Maybe we need to repurpose some of our resources. Maybe we've done well enough already on high blood pressure, but we haven't done enough on diabetes and chronic disease in that area. So I think that would be the strength of having health technology. So I noticed that that's been a kind of very central part of your healthcare
Yes.
transformation movement. And now, do you have partners in that area? Who's working on that?
Oh, absolutely. There is the Hawaii Health Information Exchange, which is the state designated entity that was using federal funds to develop kind of the information highway to exchange information. So they're building the technology to allow the transmission of records, and they're also working on the policies and the business agreements, because privacy and security is really very important
Yes.
in healthcare, and so we need to be very careful about how that information is exchanged and who has access to it and who does not.
Right.
So they're one of the crucial players in developing this.
Right, and I think it's very important because on the one hand, for instance, we went through the era where HIV/AIDS it remains a tragedy for many individuals, and we're doing better, and we're now able to live with HIV/AIDS as a chronic disease. But should that information, I know many of my patients have said, I really need to keep that private because I don't want people to judge me. This is in the days when it had a different stigma attached to the disease, but or even the insurers, there was some question as whether you could receive fair treatment. Now we all know the Affordable Care Act precludes not giving someone insurance from a pre-existing condition, which is, I think, from my standpoint, one of the best parts of the Affordable Care Act. But again, people are still very private, and they have the right to be private. Some people don't want any of their private information out there, and I can respect that. So I think that's what we're teasing out out of the HHIE, or the Hawaii Health Information Exchange work. And I think it's Christine Sakuda who's running the program, and so we'll invite Christine at some point to give us an update on what her work has been. But let me bring us back to kind of the center here. So we've established that healthcare touches all of us. We've established that it's a big spend and we need to do better. We have to break down the silos and we need to invest in the right places. To do that, we have to have a patient-centered medical home. We have to have a concept that the insurers will all embrace together so we don't have a fragmented, complicated administrative system. And we have to have health technology and health information technology specifically to help kind of tie a bow around this. Who believes in this? Who's working with you? Are you having resistance from the physicians? Are you seeing support? Who's going to pay for it? What do you expect to come from the next months to years in the program?
Well, I think that we're getting very good cooperation and involvement from a very wide variety of stakeholders. The people who have been working in this area in the state are, we're all reading the same things, we're all learning the same things. And so there is, at a high level, a great deal of agreement on better care coordination, patient-centered care, paying for quality and outcomes, investing more in care coordination, creating a system that's accountable at each step of the way to the to the betterment of the patients. And so I think that there has been a lot of buy-in by all of the insurers, by our Medicaid program, by our hospitals. You mentioned the physicians, and I would have to say that that may be a group that we have not effectively reached out to enough. We are planning to do some outreach, some focus groups with them over the course of this month. But you know, part of the problem is that doctors are really busy.
Yeah.
We don't want to take them away from their practice.
Yeah.
And so we talk to people like you who are representing their association.
Yeah.
But actually getting in the trenches and talking to the physicians, it's very challenging.
Yeah.
And we know that they're exactly the people that we want to be talking to make sure that we're changing these things that are going to help them.
Well, we'll help. You know, I appreciate you saying so, and it is a problem and a challenge. Right now in the state of Hawaii, we're about 21% short on providers across all disciplines. So they're really hustling out there, and they're facing the challenges that the federal mandates have brought down. And I think that they can sometimes be frustrated with the administrative side of healthcare rather than the clinical providing of healthcare. So hopefully a program like this will just begin to, you know, inform people. But I also think that it's going to have to come from many directions. Like the physician groups are reaching out and they're implementing these patient-centered medical homes, albeit in their first incarnations. But back 30, 40 years, you mentioned it was already out there. Dr. Calvin Sia, who's a you know, kind of an honored son of Hawaii, was one of the first people to speak of it. He's of course a legendary pediatrician. And so though there's been a basic understanding, I think that people are starting to seep into the ethos of healthcare, that there is going to be transformation. One, the system's going to look a little bit different, but don't despair because there's a method to this madness. You're basically describing a system where if we're better coordinated and we take better care of chronic disease, that maybe we don't spend quite as much money on catastrophic heart disease, on cancers that were missed, that we didn't get mammograms for women, that we didn't miss getting colonoscopies when people needed them. And by avoiding some of those very large and tragic consequences of missing healthcare diagnoses, we'll be able to invest it actually in some of this health information technology, some of these care coordinators that you mentioned that I think are going to be very central. I think that a doctor or a nurse practitioner can only do so much clinical work, that after people leave the office, a lot of the healthcare that you get is going to come from a group of fairly young, very nice and intelligent people that are working in healthcare coordination saying, okay, if you're not taking this medication, why? And if the answer is you just don't want to, maybe we can find a better way so that you don't have a stroke at an early age, or so that you don't have a heart attack at an early age. So there's going to be a lot of this. There's going to be health coaching, I would expect, because we've noticed an obesity challenge in our communities, and that's driving higher diabetes numbers and higher blood pressure rates that really can be prevented. And so we're reshaping the system. Right now, it's my understanding that we spend about 4 times as much resource in the hospital as we do in the outpatient setting. In other words, if you have to go to the ER or be admitted to the hospital or have surgery, those dollars go there and they're very valuable. You know, we so respect Queens and Hawaii Pacific Health and, you know, the HHSC hospitals for what they deliver. But on the flip side of that coin, we also want more people getting access to primary care. So do you see that as part of the challenge? We're getting to the end of the show, so give us your big vision. What do you think things are going to look like in a couple of years?
Well, I think that things are going to look very different in a couple of years, and they really need to, because the healthcare system that we have right now is not sustainable. It isn't sustainable from a cost point of view, and it isn't really good quality care. So we need to focus on primary care, care coordination. We need to take that money out of emergency rooms and unnecessary hospitalization, and invested in taking care of the people who need the care the most. Of course, that also requires some very thoughtful conversation about how do we support the hospitals, because they're essential. They're just not, they shouldn't be doing some of the things that they're called upon to do right now. And much of what we're talking about also is focused on the population that is the sickest. And so we want to make sure we have a good return on investment for our healthcare changes. And where do you get that except from the people who are overusing emergency rooms, unnecessarily being hospitalized, the people who are the sickest, that have the greatest health disparities, and we really need to invest a lot more in taking care of those people because one of the things that the federal government likes to remind us here in Hawaii is that Hawaii has some of the best health statistics in the nation, but we know that's not really an equal statement for every community. We particularly want to focus in those communities.
Well, thank you, Beth. I think you've given us an excellent perspective on the future for healthcare. So we're going to wrap up there today. Just a few closing comments. Today you've been with us in the new program, Healthcare in Hawaii. My name is Josh Green. I'm your moderator. I'm a senator and an ER physician. We've had Beth Giesting, expert from the governor's office. And I really want to commend both you and the governor for taking this issue up seriously. It really matters to our people.
Thank you very much, and I am very pleased to be here and have you as one of my colleagues in transformation.
You bet it. You bet it. And we'll be back together with Beth in the future, I'm sure. But till next week, when we have Hilton Rathel, Senior Vice President, Executive Vice President at HMSA, to answer some of the questions that Beth alluded to. We're going to have a good time together. Thanks for being with us at Healthcare in Hawaii.